Hello and welcome to Zoom in on dementia and Alzheimer's. I'm thrilled that you all are joining us today. My name is Brooks Kenny. I am an Alzheimer's advocate and advisor to Bright Focus Foundation. I've been working in the Alzheimer's space for over 12 years as an advocate, and I have had my own family experience with the disease as a caregiver. Let me tell you a little bit about Bright Focus Foundation. We are a nonprofit organization that has invested nearly $300 million in research grants, catalyzing thousands of scientific breakthroughs in life-enhancing treatments, diagnostic tools for Alzheimer's disease, macular degeneration, and glaucoma. Today's program is called Can Lifestyle Changes Prevent Alzheimer's? What the Research Reveals. And I'm really looking forward to this conversation. It's amazing to see how many of you have signed up and submitted questions. So thank you for being here. This program is supported in part by educational funding provided by Biogen, Genentech, and Lilly. And so we thank our sponsors for making this program possible. We have a fantastic expert speaker today and very compelling subject that I know everyone's excited to get to. Many of your questions were specifically related to the prevention of Alzheimer's disease and cognitive decline, but some were not, which is totally fine. And so on the screen now, you can see if you go to brightfocus.org/zoom in, as well as on YouTube, you can see a list of all of our previous episodes. One of the great things about Bright Focus Foundation is we really aim to translate the scientific research into public information for all of our constituents and make that information available on an ongoing basis. So you are welcome to tune in to any of the other topics that you would like. So now that we're through with the housekeeping, I have the honor of introducing our guest speaker. And let me tell you all, we are in for a real treat. I've been personally so inspired by our guest speaker's work over the last decade that I actually can't believe I get the honor and privilege to interview her today for this session. Our speaker today is an expert. Her name is Dr. Miia Kivipelto. She is a professor in clinical geriatrics at Karolinska Institute, Center for Alzheimer's Research. She's a senior geriatrician and director of research and development at Medical Unit Aging at Karolinska Hospital in Stockholm, Sweden. Her frontline research findings have been published in leading journals, over 430 to be exact, which is quite incredible, the contribution she has made to this field. She has received many, many awards. She has developed translational research that focuses on the prevention, early diagnosis and treatment of cognitive impairment, dementia, and Alzheimer's disease. She has identified various lifestyle and vascular risk factors for dementia and interactions with genetic factors. She is the principal investigator of the landmark, and I really mean the landmark finger trial, and founder and scientific leader of Worldwide Fingers Network. This research has been so transformative in our field, and it's really allowing so many of us to adopt lifestyle as we think about reducing cognitive decline. She's going to share more about that research with us today. The purpose of it is to find novel solutions that not only prevent cognitive impairment and dementia, but promote brain health. She's invited, as you can imagine, to speak at global dementia conferences and task forces, and we are just honored and humbled that she has joined our Zoom in on dementia here with us today. So Dr. Kivipelto, I'm going to call you Miia as we go forward here, but it's such an honor. Thank you for joining us today.
Thank you, Brooks, and thank you, Bright Focus Foundation, for this kind invitation. It's really a pleasure to be here today. Best start for the new year.
Wonderful. Well, we're going to kick things off a little different than we do sometimes on these Zoom-ins, and we're actually going to show a slide, and Miia is going to start off our discussion today by giving a brief overview of the FINGERS study and share how far the field has come in this prevention area. And then we'll take the slides down and we'll get into the meat of the questions that all of you submitted in advance. But we thought it would be a really helpful framing because this is a real landmark study and she's the principal investigator on it. So Miia, over to you, and we'll load that slide for you.
Thank you. And really the starting point here is how to prevent cognitive decline and dementia. When I started my research career more than 25 years ago, there was basically nothing or very little what we could do to prevent dementia. We had high age and genetics, and as we know, we can't do so much for these factors. So we have been studying modifiable risk factors for dementia, and I'm very happy to tell that today we know that at least 45% of all dementias are linked to modifiable risk factors, which I think is a very optimistic finding. However, quite a lot of our studies and these observations, they come from epidemiological studies. And as you surely know, given that you have been listening to previous episodes as well, clinical trials, randomized trials is the golden standard, the highest level of evidence. And we would like to have that type of evidence before we move to implementation and really using the knowledge in the societies. And Finger study was the first randomized clinical trial really showing that it is possible to prevent cognitive decline among at-risk individuals when we package together different risk factors. So clearly it's not enough to only focus on one risk factor, but we selected 5, and that's why we have the name Finger study. It's like why 1 hand and 5 fingers, and here you can see the components or the fingers which were included in the Finger study. Healthy balanced diet, very important for the brain health. Exercise, we will come back to that as well. Cognitive training, I normally say brain is like the muscle, we need to keep it active as well. Social activities and stress management, and taking care of all vascular and metabolic risk factors like blood pressure, cholesterol, glucose and diabetes and obesity. What is good for the heart is good for the brain. So this was the Finger package compared to regular health advice for 2 years. Next slide, you can see the results. The main results was for cognition. And that was clear that the persons who received the Finger intervention had better cognition, the global cognition, but also memory, planning skills, executive function, and processing speed, how quickly we can do different tasks. And as we know, these all are cognitive domains important for daily activities. So this is not only preventing dementia, it's optimizing brain health in everyday, in kind of everyday activities. On top of that, we could see many positive other effects, no negative side effects, only positive ones. There was a reduced risk of stroke and cardiovascular events. There was better functional level. Quite surprisingly, 60% lower risk for chronic diseases and especially multimorbidity. Quality of life was better, and we could even see reduced cost for healthcare and health economical benefits. So the same model gives benefits for brain health, general health on individual and on societal level. And that's why I believe Finger has been getting so much attention globally. It's now used as the model in many countries. And Brooks, you mentioned the worldwide fingers. I'm very happy to say that we are now having 70 countries involved, and we get so much good scientific evidence from these studies. So this is a short background from the Finger study, which I hope can help in the discussion. And I think there is one more slide left just to see where we are with the modifiable risk factors. And I'm so happy to see that the list is getting longer and longer year after year. Here we have a very new publication published in Lancet last summer, summarizing what is known about modifiable risk factors. You can see here that we have many cardiovascular, metabolic risk factors, diabetes. We have high blood pressure and obesity already at midlife. We know that the process leading to dementia may start 20 to 30 years before the dementia diagnosis is done. That's why I normally say it's never too early to start to prevent dementia. Physical inactivity, depression, smoking, low education, and quite interestingly, a bit newer risk factors like hearing and vision loss has now been added. Traumatic brain injury, so it's good to keep the helmet on if we do a lot of activities. high alcohol consumption, social isolation, and even air pollution. And luckily, we do have also many protective factors like healthy diet, education. And here I'm thinking not only being at school, but more lifelong learning, how we can use our brain and learn new things, and physical, mental, and social activities. And finally, we are studying novel risk factors. This is not the final list, I believe, but we are still learning a lot what are really the risk factors for brain health and decline in our functions. And here you see that it's not only depression, but also feelings of loneliness and hopelessness have been linked with an increased risk. Stress and sleep disturbances, quite common in our societies. We will surely talk more about that after a while. Impaired oral health, that could be through inflammation and infections, and even infections like COVID and herpes have been studied. So this really highlights there is no single risk factor. It's more the holistic care and trying to see which are the most important ones to each individual during the whole life course. So this is as a background, I'm very optimistic for the opportunities we have to reduce the risk of dementia.
Absolutely. It's so exciting to see the science. I mean, to see the hundreds and hundreds of studies that are happening compared to, even 5 years ago when we weren't even we were barely using the word brain health nor the word prevention associated with this, with Alzheimer's disease. So it's so wonderful to see scientific progress. So if you could just start at the kind of basic level with regard to lifestyle, you listed a lot of healthy behaviors there. Are there some that kind of come to the top based on the research? What are some of the most important healthy habits that people can adopt when they're thinking about their brain health?
I would come back to the note that dementia is a multifactorial disorder. There is no single risk factor, and that's why in the finger model we targeted several risk factors at the same time. I think that's the key concept, that you need to target many risk factors and mechanisms. However, of course, depending where we are at life, which are our risk factors, my advice would be starting seeing and checking the health profile. Which are the top risk factors for me? Is it some vascular risk factors? Is it low physical activity? Is it unhealthy diet? Or maybe it's stress and sleep disturbances. So maybe starting with the ones which are most important at that moment. And that may vary. When you are at midlife, quite often there are, as said, stress and sleep, maybe vascular risk factors. When you get older, you may have more isolation, depression, hearing, vision. So having the checks regularly and starting with the ones which are the most important at that point.
And really looking at, it's very personal, isn't it? Looking at yourself and saying, okay, among all of these things, I know for me, I'm always looking and thinking about my brain health. And one of the areas that I do not do well is sleep. So rather than picking 20 things I was going to work on in 2025, I am very focused on my sleep, and trying to build in things to get better sleep and to stay asleep. So not to share too much, but I had to pick one where I felt like I was the most depleted right now. So I appreciate that so much. Can you expand? We had a few questions about hearing loss, and I think it would be helpful for our audience to hear what is the actual risk factor around hearing loss, and what should people do if they suspect that might be an issue for themselves or a loved one? Like, how do you explain that, I guess, too, in
Yes.
lay terms? Yeah.
I think it was very interesting when the hearing loss was added to the list of modifiable risk factors. That happened 4 years ago when we had the Lancet Commission paper. And now the last one even included vision, so impaired vision. So both sensory impairments are now included. Hearing loss, as we know, is very common. It's common among adults and older people. And the tricky thing is it comes sometimes quite gradually. We don't always notice that. And that's why it's so important to be aware that may also increase the risk of dementia. Why that happens, what are the mechanisms, is not totally clear yet. One mechanism can be that if we don't hear clearly, there may be a tendency to get more isolated, not willing to be part of the conversation. If you can't hear well, you may maybe not understand what is happening. So that affects, of course, our kind of communication. But there is also another quite interesting hypothesis that if we can't hear, the hearing center in the brain is very close to the area where the memory is functioning. So somehow that part of the brain may get almost overactivated. So it may be also more closely linked to dementia pathology and Alzheimer pathology, what we have been earlier thinking. The good news is that there is something we can do for the bad hearing. You can use the hearing aids, and we know that if you start using them early, it has a better result. So absolutely something to have the check if you are worried for that, and quite easy intervention, I would say. And the thing is also, if you have impaired hearing and vision, that combination seems to increase the risk even more, because then you can't compensate. Sometimes if you don't see well or if you can't hear well, you can use some of those senses, but if both are impaired, then the risk increase seems to be even higher.
Wow, that's super interesting. We actually have a question in the chat that that's along these lines. Someone's asking, is Down syndrome one of the risk factors for dementia? And
yes,
yeah.
it is. That's a very, very good question. And we know Down syndrome, they have actually extra gene for the amyloid. And that's why many persons with Down syndrome almost all develop Alzheimer's disease if they live long enough. And that's now getting a bigger question what it has been earlier. Actually, there is a wonderful initiative, which I hope we can move on with, implementing finger model for persons who have Down syndrome. Finger down. There is a Down syndrome organization who have been now proposing that, and I really hope we can do the initiative, because we also know that Down syndrome or persons who have Down syndrome often have many of these modifiable risk factors. They have the genetics, but they also have many of the modifiable risk factors. And also back to the question why we did not include Down syndrome in the list of modifiable risk factors, because it's not modifiable as such. So we did not include any genetic factors. We also know that there are genetic forms of Alzheimer's disease, and there is risk genes like ApoE4, but they are not included in the list of modifiable risk factors.
Yes, absolutely. No, I appreciate that. So we have a couple questions related to the finger study that actually came in advance, and one was related to the study showing certain lifestyle changes slows decline, but this individual is asking how much is it being slowed and is it measurable? And then a follow-up is what constitutes at risk? So how does one know that somebody is at risk for cognitive decline?
Good questions, and not very easy ones, because how we define at risk and how we define the effect can be sometimes a bit tricky, but I will try. So in the finger trial, we started early. As I said, I normally say it's never too early to start to prevent dementia. So in finger study, persons had increased risk for dementia based on risk factors. They did not have any clear cognitive impairment, but they had some risk factors present. What we could see after the finger intervention was actually that memory and cognition were improving. They did not decline, they were getting better. And the finger group got 25% more improvement in the total cognition. There was 80% more improvement in executive function, how we are planning different things and multitasking, for example. There was 150% more improvement in processing speed, how quickly we can do different things. And there was 40% more improvement in memory. So all cognitive domains were getting better. They were not declining. And for us, that was absolutely fantastic news. On top of that, we could see that the group who did not receive finger had 30% increased risk for cognitive decline. So that's why we can even say that the same model can reduce the risk of cognitive impairment.
Wow. That's amazing.
But
I'm
again, the numbers are difficult sometimes. Like, are we talking about improvement? Are we talking about reduced risk of decline? And do we dare to say that we are really preventing something? It's a difficult question because it depends how long time we are following up the persons. Normally in trials, like in finger, it was quite long. It was 2 years, but it was too early to say because dementia may come 10 or 15 years later. So that's why the outcomes are normally cognitive functions and not dementia diagnosis.
Got it. Well, and last kind of general question, and then I want to dig into some of the specifics, but we had a question come through about what about somebody living with Alzheimer's or perhaps with mild cognitive impairment and they were diagnosed early? I mean, this whole discussion really does reinforce the need for early detection and diagnosis, right? I mean, if somebody is experiencing MCI or the early stages of Alzheimer's, what role does lifestyle play? I mean, it's as important, right? I mean, so for so long, I think we've thought, well, you have an Alzheimer's diagnosis and you're just gonna, immediately lose all of your memory and thinking and function, but that's not the case as we're diagnosing people earlier. Can you speak to that?
Yeah, that's an excellent question. And actually, after the finger study, I got the question from my patients at our memory clinic asking, is it too late? Can I still do something with lifestyle? And that's why we started a new study. We adopted the finger model for persons who had early Alzheimer's disease and some modifiable risk factors. And the results were very good, much better what I did to even hope. Already after 6 months, the persons who received finger had better functional level, even cognition was stabilizing, it was not declining. And of course, the feedback from the patients and caregivers was very positive. They said that it felt that they got back the control, they could do something. So it was not only cognition, it was also the quality of life and kind of functional level. And that's why I normally say it's never too late. The effect of the intervention is not ending the day person is getting the diagnosis. I would say the opposite. Brain needs so much that day. So I really hope that we can implement this at our memory clinics and in the societies, that all persons who have cognitive impairment can get support to implement all these healthy lifestyle factors.
Yeah, I mean, there's just so much hope around this. And just to put the finer point on it, Miia, when you say people received fingers, so what that means is they were in your study for 2 years, they were implementing exercise. Give us some of the kind of practical things that you're experiencing that led to great results.
That's a good question. How you can do that? So it was not only me telling them that you need to exercise and you need to eat healthy food, because that's not so easy. So what they received was more packets of the finger intervention. We had a dietitian who helped them to eat healthier food. Many people know in theory what is the healthy diet, but it's not as easy to change your lifestyle. So what we did, we had cooking classes. We gave very practical inspiration and kind of practice how you can cook, how you can do your shopping in a more healthy way. How can I modify my diet that is a bit more healthy? And that was very, very popular. For physical activity, we had the group exercise. So we took the persons and they did some of the training together, which was very popular. And they get advice from the physiotherapist, what is the best physical activity for that person. For cognitive training, we used a computer-based cognitive training program. And for the cardiovascular things, they had a chance to meet a study doctor and nurse to measure all the things. And if someone had high blood pressure or high lipids, then they got medication for that. So it was simply going through all the 5 fingers and follow up, and both individual and group meetings. And I need to say that the group meetings, the social part, was one of the most popular one, because when you do things together, you get extra motivation and also some social stimulation as well.
Absolutely. That's so fantastic. That's great. And really appreciate that we can all read and we all know what's good for us. And but having the tools and then having some of that ongoing coaching and guidance is really exciting. And then
Important. Yeah.
results are there to see. All right, let's dig into exercise a little bit. I don't know where people are tuning in around the country, but I'm right outside of Washington, D.C., and we've got the more snow than we've had in 5 years, and it's, I think, 15 degrees. But we still got out there. We're still getting out there and walking as much as we can, right? I would love to kind of hear how you think about exercise. We have a lot of questions about what type of activity is best, how often, how rigorous, how aerobic. So if you could kind of dig into the exercise piece, I really want people to come away with something that people feel is achievable in terms of what they can be doing to implement exercise in their routine.
I would say that exercise is one of my favorite risk factors. It's maybe one of the most studied. There are so many studies showing the positive results for brain health, reduced risk of cognitive decline, but also many other health outcomes. So that's absolutely something we can take with us. Then also the effect and what type of exercise is the best one. I would say all type of exercise is good. Every step, every movement is important. So depending where you start, even starting with small steps is important. Why this is so important is because we are having so sedentary lifestyle. Do you know how many hours we are sitting every day? 9 to 10 hours. Children, middle life people, older people, 9 to 10 hours. And it's difficult to compensate that amount of sedentary lifestyle and sitting, even though we are physically active. And that's why having even a small movement break every half an hour is very important. Taking stairs, taking a few more steps, that I would say is the basis of all exercise. And then we can build and add more different types of physical activity, for example, aerobic exercise, strength training, and balance training. But the everyday physical activity, I think, is really the basis for the good brain health.
Great. And someone was asking, there are two interesting questions here. One about the impact of weight loss and a favorable body composition and Alzheimer's. And I guess they kind of wrapped that into thinking about the exercise. Do we know much about?
Yeah. And that's a good question. What is the mechanisms, how exercise affects the brain and how it can reduce the risk of dementia? I think that's also the nice thing with exercise. It's like a miracle medicine. It has so many different possible mechanisms how it can reduce the risk. One is, of course, through other risk factors like obesity. It can reduce the risk of diabetes. It can reduce the blood pressure. So many of the other risk factors which I showed, exercise can affect and reduce them. So that is one way how it can reduce the risk of dementia. But there are also more direct mechanisms, like you mentioned, the fitness or the cardiovascular fitness. There are studies showing that people who have better midlife cardiovascular fitness had a lower risk for dementia 40 years later. That's a study from Sweden showing that. So there seems to be also more direct effect if you have a better fitness that can reduce the risk of dementia. It can also go through vascular pathways, like the blood flow to the brain can be better if you have a good circulation in your body. And there are also very interesting studies showing that the area in the brain, hippocampus, that is important for memory, for persons who are physically active, that part of the brain seems to be large. So it can somehow more directly also stimulate the brain and affect various neurotransmitters. And that's why I love physical activity so much, that's so many different mechanisms there as well. And also one thing, you don't again need to do huge amount of physical activity. Already 10 minutes. There is a study showing that persons who were physically active 10 minutes, almost 10,000 different molecules and biomarkers were affected. Not only Alzheimer related, but inflammation, all these cardiovascular diabetes. So it's really releasing many substances in the body. And that's why even 10 minutes walk is absolutely better than nothing.
That's amazing. All right. Well, hopefully we're all motivated to get those steps in.
Yes.
And certainly feel free, folks, to post in the chat if you have any other specific questions about exercise. I'm going to move along to food and diet.
One more thing, because you asked it and I did not answer. You said aerobic strength and balance. Why these three? And maybe I did not answer that yet clearly enough. I would combine all three, and that's what we did in finger. Because of course the aerobic exercise is good for the circulation, which I mentioned, but even muscle training is good, especially for older people, because we have the tendency to lose our muscles. We talk about sarcopenia when we get older. And we could see it in the finger trial that when people first trained the muscles, then they could much easier do the cycling or walking or jogging, whatever they wanted to do. And the third one, why balance training? Of course, we don't want people to fall. So training your balance as well is good. So I would recommend all these three like we did in the finger study.
That's great. Thank you for adding that. That's really helpful. Okay, let's talk about food and lifestyle. And, we know there's foods that are better for you, and would love to kind of understand the science around lifestyle related to food, and perhaps if you could expand upon the mind diet. We also have a question in here about full fat foods, like the different oils. So would love to hear a little bit on that topic.
Yes, I really would say that the brain needs good food and nutrients throughout the whole life. The brain is only 2% of the whole body weight, but it uses more than 25% of the energy. So brain needs nutrients and brain needs energy. And especially when we are getting older and when we start to have cognitive impairment, it's very important to think that brain gets healthy, balanced diet every day. What is the best diet for the brain is, of course, a good question. And you can understand that diet is quite complex. What we are talking about, is it single nutrients? Is it the dietary pattern? And the tendency in the dementia field is to move, is not only single nutrients or single foods, it's more the dietary pattern, what we are eating, what is the different compositions there. And there are some dietary patterns which have been shown to be good for the brain health. We have the Mediterranean diet, which I believe many of you know. We have the Dutch diet that is more designed to manage the hypertension. We have the Mind diet that is a combination between Mediterranean diet and Dutch diet. And we have, for example, the healthy Nordic diet like we have in Sweden and Finland. All these healthy dietary patterns are very similar, to be honest. There are not huge differences. They have a bit different names. And of course, in different parts of the world, we have a bit different foods available. So that's why there are some differences, but the basics are the same. And that means that in all these diets, there are a lot of fruits, vegetables, berries, nuts, olive oils, a lot of fish, a lot of seafood, less red meat, and especially reducing the amount of processed meat, less salt and sugar. So that's the basic components of all these healthy diets. Many of the studies are still from observational studies, but there are now, luckily, some randomized trials showing that, for example, the Mediterranean diet seems to reduce the risk of cognitive impairment and even dementia. And like in finger, we had the healthy Nordic diet as part of the multi-domain intervention.
And how does that translate for people living with mild cognitive impairment or Alzheimer's disease? Are there studies showing that diet has a positive impact for them as well, even if they have a diagnosis?
Yes, there is, and there are also the recommendations and guidelines. For example, WHO has the risk reduction guidelines stating that Mediterranean type of diet is recommended for persons with normal cognition and mild cognitive impairment to reduce the risk of cognitive decline and dementia. So that is already part of the recommendations. We did the same in our finger trial targeting persons persons with early Alzheimer's disease, they got the dietary intervention. It was part of the multi-domain intervention, but we could clearly see that especially for persons with early Alzheimer, they needed to get more advice and support, because in Alzheimer's disease, you sometimes are not eating well, and you may have some deficiency for some important nutrients. So it's extra important for those persons to really take care of the good nutrition. So again, it's never too late. And I'm thinking the food, it can be also a nice social moment. That's what we did in our study. The persons were cooking together, they were eating with the family, they were discussing about the food. So you could try to find some practical solutions how you capture many fingers at the same time.
And what I love about this too is we're not necessarily telling people what to take off their list. We're telling people what to add to their plate, right? Things that are healthy, things that are whole, things that are nutritious. So I think it's a way, no pun intended, but it's a mindset rather than saying avoid this, take away that. It's nice to kind of remind people.
Exactly. And that's the whole philosophy, I think, in the finger as well. We are not saying, no, don't do that. It's more adding positive things. What can I do to add more layers of protection? Can I add healthy habits? Can I add a bit more nuts or olive oil or fruit? So it's not so much taking away, it's really adding the positive things. And that's also what I love. The list of positive factors is getting longer and longer. Maybe we should talk more about protective factors, not so much about risk factors.
Yeah, that's great. All right, well, my favorite one, let's talk about sleep. I'm not going to ask for a show of hands who has trouble sleeping or staying asleep, but I'll raise mine. So if you could help us understand, what are the sleep patterns that we want to avoid, or that we want to encourage, I should say, how, the length of sleep. I've seen lots of different resources around this, and what are the risk factors if people aren't getting enough sleep or if their sleep is interrupted?
Yeah, that's a good question. And I agree, sleep disturbances they are very common. Around 50% of older adults or adults in general have some type of sleep problems. And I have a feeling that they have been increasing. So if we are thinking the list of modifiable risk factors, we are maybe taking care of some of the other risk factors. Smoking has been reducing. We are medicating and treating hypertension, but sleep and stress are maybe the new risk factors in our societies, and even younger persons are having challenges with those. Sleep, it has been more difficult factor to study, because you can imagine, for example, measuring blood pressure is quite easy. But how can you ask your sleep? How many hours I have been sleeping is quite a lot of subjective feelings in the sleep. And that has been maybe one limitation why it took a while before we added the sleep to the list of modifiable risk factors. What do we know now about sleep is that persons who don't sleep enough, what is enough is good question, because that may vary between different people, but let's say less than 5 hours all the time, there are studies showing that this type of sleep disturbances can increase the risk of dementia. On the other hand, if you sleep too much and you have the daytime sleepiness as well, that can also increase the risk. And other type of sleep disturbances, sleep apnea, for example, is one of the risk factors. But is that the risk, or can that also be a consequence that something is going on? Because dementia may also affect and change the sleep pattern what we are having. But many researchers, inclusive myself, believe that sleep disturbances can indeed increase the risk. And why is that happening? Well, during the sleep, especially the deep sleep, I say that it's like the washing machine for the brain. We take away many toxins like amyloid, inflammatory markers. So during the sleep, it's not passive. Brain needs that phase to get rid of different toxins from the brain. And also, as we all know, even when we were at school, it's good to sleep because your memory is working better, and that's still true, especially in our time when there is so much information coming. So brain needs some rest, and really that the memories are getting there, and we can use our brain in the most optimal way. And I think this is a challenge in our societies, as said, with so much screen time and so much information coming. So I would really like to highlight we need to live an active life, but brain needs also some rest.
So how did you manage that in the finger study? How did you encourage sleep with your participants?
So in the original finger study, we did not have anything specific for sleep because that came later. But now finger is ongoing in 70 countries. So now we have been enlarging the fourth finger, that was the social activity. So now it's called social activity, stress management, and sleep disturbances. We try to take care of that as well. First, we give information why sleep is important. We give the basic information about sleep hygiene, what to do, how you calm down in the evening, what you should do and what you should not do, not eating too heavy meals, not drinking too much alcohol or coffee or smoking, screen time, try to reduce. So all these things which are available. But then there are also opportunities of having more psychological support if needed for some individuals. So that's now happening in some finger studies.
Got it. Thank you. That's helpful.
And one part of that is, of course, the relaxation. So we try to have the stress management. If you are too stressed, maybe sleep is also affected. So meditation, yoga, some kind of stress management is part of the sleep improvement as well. So many of the risk factors are kind of going hand in hand. They are interrelated.
Yeah, we had a question in the chat, I think, about stress and let me try to find it, and just asking how that's a factor, family, work, financial, dealing with disease. How is that how is stress a factor in Alzheimer's disease?
It is.
Yeah.
Yeah, and that's the same thing. There are studies showing stress hormones, for example, high levels of cortisol is affecting the brain, the areas in the brain related to Alzheimer's disease. So stress is also one of those more novel risk factors. And with the new technology available, we can also measure better both sleep and stress. So that is now, I believe the research is really able to capture the biomarkers for these new risk factors as well.
And am I right in, I'm not a researcher, I'm an advocate, but I feel like I've read that it's not like to reduce stress, we have to meditate for an hour every day. I mean, we can have small moments of time in our day to take some deep breaths and reduce our stress that actually move the needle a little bit. Can you speak?
Correct. Exactly correct. The same like in physical activity, you don't need to do it always just to get started. So it can be some breathing, some relaxation, a few minutes between the meetings or before you go. It's for finding these small moments. For example, in the morning before you open your laptop, do something else to calm down, or in the evening. So finding these small moments in your daily routines.
Yeah, absolutely. I think sometimes people, I myself included, get overwhelmed with thinking about all of the things, but recognizing you can do small steps and collectively, they certainly help. We've talked a lot about and heard a lot about cognitive training, and you see people say, oh, I'm going to do a crossword puzzle, or I'm going to do this, or I'm going to do that. And I think there's some misunderstanding about cognitive training and what the brain needs as we think about learning new things or using our brain as a muscle. Can you speak? And I see Anne there knitting, and I've been watching her the whole time. I don't know if that's a new thing or not, but I know if it's new, it's good for your brain, and it's probably good for your stress too. But would love to hear a little bit more about cognitive training.
Yeah, that can be, it's so broad definition. What we do here now, this is cognitive training because we are discussing different topics. You are listening, you are asking questions. So in a way, everything what we do can be cognitive training. Of course, in the studies like in finger, we have been using more specific cognitive training programs. It can be paper and pen like crosswords or Sudoku or puzzle, or doing something that really stimulates your brain a bit more than the normal kind of daily activities. How good they are and what is the mechanisms is of course still a bit unclear, but brain has a wonderful capacity we can build a cognitive reserve or brain reserve. So what we do, everything what we do can affect the structure, and the function of the brain. And that is wonderful because if we get some changes, like Alzheimer changes in the brain can compensate and brain can adapt. And that concept, cognitive reserve, brain reserve, is really, really great. And in a way, the cognitive training uses or builds that cognitive reserve in your brain. There are more connections or more synapses between nerve cells. So it really, brain is plastic, like muscles, like we train them. So you can really change and affect your brain. And I think that is really, really great. But then what to do? What's the best way for you to train your brain? Well, I normally say try to find new things, especially when you get older, if you are not working anymore. So try to find new challenges. That's what the brain likes, doing something different, what you normally not do every day. And try to do something with others, like playing computer games with your grandchildren, or reading a new book, or learning a new language, something that you have not been doing earlier. So that's really, really good training for the brain.
And I love that the way you're thinking about it and sharing it is like, it is a muscle, just like anything else. And so just like you might lift dumbbells for your biceps, you need to do things that are going to make your brain work and grow. So that's super helpful. One of the topics we spoke about in advance of this, because it continues to come up, is the topic of supplements. And if you could share, there's so much information out there and stuff coming at us all the time about this supplement or that. And I won't ask you to speak to any specific where the data isn't there, but how would you share with our audience how to think about supplements and how to navigate that topic as it relates to brain health?
Yeah, and it's a difficult question, and we are not yet ready in our research either. But where we are now, there is no clear evidence. There is no clear evidence yet, at least, that any supplements or vitamins would give any clear benefit to reduce the risk of dementia. That's stated at the WHO guidelines and in the Lancet Commission paper, taking together all studies. No clear evidence that taking extra vitamins or supplements would give a clear benefit, at least. However, there are, of course, some interesting observations. Vitamin D, vitamin B12, if you have lack of these vitamins, you may get some benefit. In the finger intervention, we did not recommend any supplements, but vitamin D was recommended because I live in Scandinavia. We do not have so much sun, so people need to get some extra vitamin D, not specifically for dementia, but for other reasons as well. Vitamin B12 deficiency is very common. So of course, if you have low level of vitamin B12, then you may need something extra. And there was one interesting study quite recently in the US called Cosmos Mind. I don't know if Laura Baker talked about that already earlier, but that was testing the multivitamins. It was a secondary analysis, but that study showed that multivitamins could actually give some benefit for persons with mild cognitive impairment. The risk for cognitive decline was a bit slower. Difficult to say how big that benefit is, but my thinking is that the extra vitamins might help some targeted persons, not in general, not the whole population, but if person has a lack of vitamins or there is some specific needs. But clearly more studies are needed.
Absolutely. That's super helpful. Thank you. And I just want to remind everyone that you are welcome to post in the chat if you have questions. And if you're listening on YouTube, you can post your questions there and we will see them. We actually have one that just came in asking about fasting and if fasting is a valuable lifestyle.
Yeah, for many of these nutrition-related aspects like fasting, there are smaller studies showing some benefits, and for some individuals, And of course, fasting can help if you have some glucose related things, but no large studies again. So I would say for nutrition, and also this comes back to the supplements, I hope we are moving towards personalized precision medicine. Maybe one size does not fit all. Maybe we need to understand more about the metabolism. How is my metabolism? What type of diet is beneficial for me? We are just now having a study ongoing, testing ketogenic diet together with fasting. So a bit more kind of flexible ketogenic diet, but having this overnight fasting that the people are fasting at least the 12 hours. We don't know yet how that works, but there are interesting studies out there which hopefully can give more solid answers to these questions.
That's fantastic. Just had another one come in about if somebody has the APO4 gene, are these lifestyle interventions as important, more important? Will they make an impact? I know there's a lot of concern around genetics.
Yeah, that's a good question. And luckily, we now, based on the worldwide finger studies, that if you have ApoE4, the multi-domain lifestyle intervention may be even more beneficial and even more important. We could see that in the finger trial first, that ApoE4 carriers got more benefit. Now we have been seeing the same results from Japan, the Japanese finger study with very different genetics, and also from France. And that makes me more confident to say that that may actually be the fact. If you have the genetics, we may be able to modify the risk, and at least in the best case, to postpone the onset of cognitive decline. So that is very, very good news.
Absolutely. Miia, what do you see as being next on the horizon? Here we are in Alzheimer's disease in particular with multiple therapies now for the earliest stages of disease, more therapies supporting symptoms rather, all this attention around lifestyle and prevention. What do you see on the horizon, and what are you most excited about as it relates to prevention and lifestyle?
I think there is so much we can do already today, and I think there is enough evidence to justify immediate action. So I would really like to see more implementation. Normally, it takes 15 years to start to implement the research findings. When it comes to prevention, I think we can't wait because we need to try to manage the dementia epidemic. And we know that if we could just postpone the onset of dementia by 5 years, the amount of patients would decrease by 50%. So I think from individual, but also from the societal perspective, I hope we can start implementing this and sharing the knowledge what we can do for the better brain health. This is one, more implementation and more awareness. And this session today, I think is very, very much on really the top of that level. The second thing I would like to see is this precision medicine, going deeper, I say more tailoring the interventions to different target populations, and also combination therapies. I think lifestyle should always be the basis, and then we add different medications when needed. So it's not lifestyle or drugs, it's the combination to get the best benefit. And again, testing different types of medications. We are now combining finger with diabetes medication, metformin. We are hoping to start a trial with semaglutide, this new diabetes medication. And why not combining multi-domain lifestyle and anti-amyloid treatments? Because then you may actually reduce the side effects and get even more benefits. So it's again the precision medicine, adding the therapies when needed. The right person should get the right treatment at the right time.
Absolutely. That's fantastic. Well, I am so sad to say that we are close to our end, and I'm going to ask our team to pull up some of our resources that we want to share now. I just want to say thank you so much for not just being a trailblazer in this field and making it possible for us to learn so much, but for telling us, sharing with us today, some of the themes that I heard. Most importantly is there's so much hope and there's so much data. It's never too late. It's never too early. If we think about lifestyle, 45% of cases can actually be prevented if we think about exercise, diet, sleep, reducing risks, hearing loss, vision loss, training our brains, being socially active, all of these things. We can have these things be small steps that we take to reduce our stress and to bring more healthy behaviors into our lives. So I really want to thank you so much. The other key message I heard over and over from you, which I want everyone to take home with them, is that it should really be designed for you. So when you think about prevention for yourself, for your loved one, thinking about ways that you can make changes that are achievable, that feel good, and that are relevant to you specifically, which I think is such an important takeaway. So thank you. I also want to just invite our audience to check out our resources. We have everything is free, publications around Alzheimer's disease, which you are more than welcome to access. We have a wealth of resources online. We will answer your questions. If you don't see something, you are welcome to call us or send us an email at info@brightfocus.org. You can always go back and listen to episodes of Zoom In at brightfocus.org/zoom-in. We will be sending out a recording and transcript of this episode to all of you by email, usually in about a week or so. And we'll include links to the resources we discussed today. In particular, we'll make sure we link to the information about Finger and the Worldwide Fingers Network. We'll have things in there about the Lancet Commission, and we'll be sure to link to our brain health section on the Bright Focus website. If you do have ideas for future episodes, please share them with us. I mean, as I said, there were 900 people registered. I don't know how many people end up on YouTube. So we had hundreds here today, and I'm assuming hundreds more on YouTube. But we want to hear from you. You all are the people that we get up to serve every day. And that's why we're here. So if you have topics that are important to you and your family and your community, please write to us, and we will incorporate them and bring you the experts as often as we can. In February, we will have 2 episodes, starting with Zoom In Clinical Research. That one is on February 6th at 1 p.m. Eastern. And then our second and regular Zoom In episode will be on February 20th. So please mark your calendars, and we will be back in touch with all of you, and we'll have the topics to share, but we will certainly want you to have those dates in mind. As a reminder, we do have them every month with the exception of August and December. And then we've added clinical research so we can give you all kind of behind the scenes look at what a clinical research study looks like, and how you can get involved and how you can participate in your own community. In closing, Dr. Kivipelto, I just want to thank you again on behalf of Bright Focus Foundation and our entire community, not only for your amazing work, but for your generosity in sharing it with us today.
Thank you. My pleasure. It's teamwork.
It is. We're all in it together, and we need everybody. So with that, I'll just say, wherever you are, I hope you're are staying warm in this winter months. If our hearts do go out to our community in California during these horrendous fires. So weren't able to say that up front, and just wanted to make sure we commented that here now. And we were thinking of our community there. Thanks for being with us today, and thanks for being part of Bright Focus Foundation. Take care.